Hi guys, this is me Jamsha Hannan, and today we will be discussing about impression material classification and requirements. So basically, first of all, you need to understand the definition of impression materials, like why we use impression materials and dental materials. Okay, what's the purpose basically? So you need to remember this. Okay, if we talk about the definition of impression material, so it is a negative record of the tissues of the mouth, obviously, and it is used to register or reproduce the form of relationship of teeth and the surroundings. Okay, I hope I'm helping you all in your notes basically. And and if we talk about like further more details about the dental materials, so it helps in our crown, bridges, and all. Okay, prosthodontics. Okay, and impression materials is the negative record of the tissue of the mouth or the patient, and casting is the positive record of the patient's mouth. Okay, when we pour gypsum with impression material, so gypsum impression with gypsum product of and the cast. Okay, so the cast is the positive record of the patient. So you need to remember this. Okay, so what are the desirable properties of impression materials? There are 12 basic desirable properties. The accuracy, which is the most important one, pleasant taste, odor, and color, means that it should be dental materials should have proper pleasant taste, odor, and color. I mean, patient would like the taste of it, odor, and color also. And it is non-toxic. It should be non-toxic to the patient and non-irritating. Adequate shelf life means shouldn't deteriorate during storage in short time when you store it in your clinic, so it shouldn't be deteriorate. Okay, and for the economical purpose, it should be cheap. Okay, and minimum equipments require an adequate setting characteristic, acceptable consistency and texture, greater strength. Sufficient strength means you have the sufficient strength. Greater elastic properties means acceptable elastic properties, and stable under humidity and the greater temperature. Okay, basically, and compatible with the gypsum products. That's the main and important point, that compatible with the gypsum product. Okay, so if we classify impression materials, so we will be classifying them into 4. Okay, according to mode of setting, according to dental use, according to chemical properties, according to viscosity. According to mode of setting, set of the chemical reaction, so it includes impression plaster, zinc oxide, eugenol, impression waxes, alginate, polysulfides, polyethers, and silicons. And set by temperature, impression compound and agar. Okay, we will be discussing about impression compound later. According to dental use, we have the edentulous mouth and dentulous mouth. Edentulous mouth is when we have no retention, means there is no teeth in the mouth, and dentulous mouth, obviously there is teeth and the proper oral cavity. Okay, edentulous mouth. In edentulous mouth, we use impression plaster, impression waxes, impression compound, zinc oxide, eugenol, which is Zoe. And for the dentulous mouth, we use alginate, agar, synthetic elastomers. According to chemical properties, before setting, we have the mucostatic and mucocompressive compounds. And mucostatic includes the impression plaster, zinc oxide, eugenol, impression waxes, alginate, and agar. Mucocompressive includes impression compounds, putty, elastomers. And after setting, you have the flow chart in this book. Okay, let me show you this. This chart is really important, okay, according to viscosity. Okay, this chart is really important. Okay, so as you can see here, there are impression materials, obviously impression materials, and according to viscosity, there is high viscosity, medium viscosity, and low viscosity. High viscosity is further divided into impression compounds and putty elastomers. Medium viscosity divided into regular elastomers, and low viscosity comprised of impression plaster, impression paste, hydrocolloids, which is the most important part of this chapter, and light body elastomers. Hydrocolloids are further divided into irreversible hydrocolloids, which cannot be reversible, obviously, as the name it's saying, okay, and the reversible hydrocolloids. Classification of impression materials by viscosity at a constant shear rate and temperature. And as you can see here, after 16.1 figure, there is 16.2. So you can appreciate the figure 16.2 here. Obviously, there is impression materials, which can be divided into elastic materials and non-elastic materials. Elastic materials are further divided into synthetic elastomers, which we will be discussing in our later on. Okay, we will be discussing them. Hydrocolloids. Synthetic elastomers are polysulfides, silicones, polyethers, and hydrocolloids are reversible agar, irreversible alginate. Non-elastic elastomers are impression plaster, impression compounds, zinc oxide, eugenol paste, and impression waxes. Classification according to the elastic properties and chemical type. Okay, and you need to remember, okay, after doing this, you need to remember this part. Okay, you need to remember this part. The accuracy till the stone. Okay, so what does it mean? Like, the accuracy of the model depends on the accuracy of the impression in which it was cast. Okay, I have discussed cast already, so don't worry about it. Just take the basic concept of cast. An impression stage, in which we have the first of many stages involved in the production of dentures, crowns, bridges, orthodontic appliances, etc. So basically, it helps in our oral tissues. Impression materials helps in the relationship of the formation of teeth and the oral tissues. And there is impression materials are generally transferred to the patient's mouth in an impression tray. Okay, we will be discussing in detail the impression tray. Okay, so don't worry about it. Impression tray is, just take the concept that impression tray is required because materials are initially quite fluid and requires support. Obviously, once positioned in the patient's mouth, the materials undergo setting by either a chemical or physical process. After setting, the impression is removed from the patient's mouth and the model cast using dental plaster. Okay, so as you can see here on your left or right side, I don't know, like, I'm a little bit confused in this. So before setting, the property most normally used to characterize materials in viscosity. This may impressions of hard tissues and may influence the degree of tissue compression and displacement achieved with soft tissue impressions. So you just need to remember this mucostatic impression materials and the mucocompressive impression materials. Okay, I know this book is tricky one, but yeah. And there is this term pseudoplastic, which what is pseudoplastic? Pseudo means false and the false plastic. Okay, it is said to be false plastic. So you need to remember this. And after this we will be discussing this material involves in consideration of properties of the set materials. This factor is primarily responsible for governing the principal applications of the materials. The properties which are most important are rigidity and elasticity. You need to remember the rigidity and the elasticity of the material. Okay, rigidity and elasticity is the most important feature of the dental material. Okay, you need to remember this. So yeah, you need to remember this. And then we have this the properties. Okay, we have discussed the properties. The flexible part, obviously the elastic impression materials, and the non-flexible part or the rigid part is the non-elastic impression materials. Obviously there is elastic and non-elastic impression materials. Okay, you can differentiate in this. Okay, and then skip all and come here on requirements. Okay, requirements, you need to memorize these 4 factors. Okay, basically these are the 4 important factors which you need to remember. And factors affect the accuracy of the impression materials. As I told you before, that accuracy is the most important factor. And dimensional stability, manipulative variables, additional factors such as cost, taste, color. I have discussed them already. Okay, so now we will be discussing about the accuracy of the impression material. Okay, so they should be viscous. Okay, you need to remember that they should be viscous, and when seated in mouth, so impression materials should be viscous. Okay, so mark from the impression material from the pseudoplasticity to the pseudoplasticity. Okay, the impression material should be fluid on insertion into the patient's mouth. This requires a low viscosity or a degree of pseudoplasticity. I have discussed pseudoplasticity. Okay, and and read this from here to here. Like the way in which the material interacts with the saliva is another factor affecting the fine detail. Reproduction, some products are hydrophobic. Okay, hydrophobic, which repel the saliva, bacteria and other organisms, and hydrophilic, which do not repel. Okay, and maybe, as you can see here, that may be repelled by moisture in a critical area of the impression. This normally results in the formation of a blow hole in the impression. Okay, so so mark from the fine detail. Okay, the fine detail recorded in an impression will only be transferred to the gypsum cast if there is adequate setting. adequate wetting of the impression surface by the freshly mixed dental stone or plaster. Okay, in cases, so this is the important point. Okay, this is the important point. In cases, there is this, in cases material, the hydrophilic slurry of calcium sulfate hemihydrate in water may not be able to approach closely enough to the surface of the impression. Okay, this is the important point. And then we have a low contact. Okay, start from here. A low contact angle of the favorable a low contact angle is favorable as it indicates good wedding. Okay, and then read the whole paragraph after this. The setting of the impression materials, whether it involves a chemical reaction or simply a physical change of state, generally results in a dimensional changes which naturally affects accuracy. For most materials, the dimensional change is contraction, and providing the impression material is firmly attached to the impression tray. This produces an expansion of impression space and an oversized die as illustrated in figure 16.3. Okay, as you can see here, the diagram, you can easily appreciate the diagram 16.3. And in this diagram, there is diagram illustrating the effect of the setting contraction. If the impression material is bonded to the tray, contraction occurs towards the tray. Okay, you can really appreciate this diagram. Okay, according to A point. And then we have the B diagram, in which you can see the contraction results in an oversized impression space, and in C diagram you can see the results in an oversized die. Okay, so oversized die. Okay, materials which expand during setting results in undersized dies or cast. Okay, we have already discussed these 3 points. Next paragraph. Move on to next paragraph here. On being withdrawn from the patient's mouth, which is typically at a temperature of 32 to 37 degrees centigrade, into the dental surgery at a temperature of around 23 degrees centigrade, the impression undergoes approximately 10 degree cooling. This results in the thermal contraction, the magnitude of which depends on the value of coefficient of thermal expansion of impression material and impression tray to which it is attached. Okay, after this you please come to the next para. It is important. Okay, it is important that the impression material remains attached to the impression tray during the recording of the impression. Partial detachment may cause gross deteriorations of the impression which may remain undetected and will almost certainly lead to ill-fitting appliances or restorations. Manufacturers of impression materials often supply tray adhesive which are used to enhance bonding. Additional retention is achieved by using perforated trays. Okay, this is the important part. 2 more requirements here, like adequate elastic properties and adequate tear resistance. Okay, deterioration, as I have mentioned before. So come to the next paragraph. Okay, come to the next side. Okay, come to the next side and start from the AB See, okay, consecutively. Read all these points because these are the important points. And elastic material, aplastic material, and viscoelastic material. The impression recorded with the elastic material accurately records the true shape of the tooth with the correct degree of undercuts. The impression recorded with the plastic material has been grossly distorted during removal and has not recorded any undercuts. So read it and then come to the next page. And here you can see if a degree of viscoelasticity exists, deteriorations can be minimized by ensuring that the material is not maintained in the strained position for longer than necessary by removing the impression quickly. Okay, and after that the whole para, you need to read the whole para. So we are done with the accuracy, and now we will be studying the dimensional stability. First of all, you need to remember about the dimensional stability is that the expressions made from these materials should remain dimensionally stable until the model is poured. Are you getting it? So come to the next point of next side of the dimensional stability. So here you can see the way in which the accuracy of the impression changes during this period is a measure of its dimensional stability. Okay, and then come to the several factors. Okay, these are the important factors. Okay, the four main important factors. Several factors contribute towards dimensional changes during storage of transportation of impressions. Continuation of setting reaction beyond the apparent setting time may cause dimensional changes over a period of time. For viscoelastic materials, slow elastic recovery may continue for some time after withdrawal of the impression, producing a dimensional change. In this case, the dimensional change results in a more accurate impression. For some elastic materials, it has been suggested that one should allow a rest period after withdrawing the impression before pouring the gypsum cast to allow elastic recovery to occur more fully. Okay, and some impression materials develop internal stresses on cooling from the temperature at which the impression is recorded to room temperature. Okay, after this, mark from the Finally, many impression materials contain volatile substances, other as primary components or as byproducts of setting reactions. Loss of such volatile materials during storage results in a shrinkage of the impression material, with a consequent decrease in accuracy. For the majority of materials, accuracy is best maintained by pouring the gypsum cast soon after recording the impression.